Almost all of us are affected by osteoarthritis at some point when we get old enough. With the right diet, however, we can take effective countermeasures. The earlier you start, the longer you will remain mobile in old age. Do you often feel stiff in the morning after getting up? This is a typical sign. Do you experience such a startup pain? Does your hip pinch here and your knee pinch there when you walk, especially when you get up from a park bench? These could be the first signs of the onset of osteoarthritis, which is the most common joint disease worldwide. What happens with osteoarthritis? Very fine wear and tear of the joint cartilage, which protects the bones of the joint so that the bone ends of the joint then rub painfully against each other, so to speak. The bad news is that these changes are no longer curable once they are really advanced. Once the cartilage is completely gone, it can no longer be healed. But surgery is still possible. The good news is that you can prevent osteoarthritis, slow down its progression, and perhaps even reduce the pain by adopting a healthy lifestyle, especially diet, but also exercise, sport, and above all, nutrition. And that's why I'd like to introduce you to my 5 top foods in this video that you can use to fight osteoarthritis. Hello, my name is Dr. Tobias Wagel. With my YouTube channel, I want to provide understandable information about diseases, causes of diseases, and symptoms, but also about exercise and nutrition, because everything is very closely related, such as nutrition and osteoarthritis. And if you don't want to miss anything, then subscribe to my channel. As you likely know, osteoarthritis is one of the typical diseases of old age. Half of the women and a third of the men over the age of 60 are affected. And almost no one over the age of 80 is osteoarthritis-free. But also note, if you have osteoarthritis, that doesn't mean that you have pain and problems. Did you know that the process of wear and tear often begins at a younger age? That's logical. So even if you are still symptom-free, it is quite possible that the degradation process in your joints has already begun unnoticed, that the cartilage is already disappearing more and more, so to speak. I compare it to a car tire where the tread is disappearing more and more. Knees, hips, wrists, and thumbs, for example, are particularly susceptible. When and whether the first symptoms become noticeable depends on factors that cannot be influenced, such as age. We automatically get older and not younger. And also genetics, which is what we are born with. However, and this is crucial, there are risk factors that can be influenced. For example, overweight is a risk factor for developing osteoarthritis. In addition, lack of exercise and poor nutrition. In order to slow down the progression of osteoarthritis, it is super important to start with the following 3 cornerstones. Appropriate exercise, and there is also good osteoarthritis exercise, weight normalization so that less pressure is placed on this joint, so to speak, where the cartilage is gone, and thirdly, also a healthy diet. And the earlier you pay attention to this, the greater your chances of staying fit and mobile for longer, and perhaps reducing your symptoms. How does diet affect osteoarthritis? Let's discuss the topic of nutrition. As already mentioned, osteoarthritis is not curable. Nevertheless, a healthy diet can have a strong influence on the health of your joints, and it may reduce the symptoms of disease. Just because symptoms are gone doesn't mean the disease is. We know that people who eat an unhealthy diet have a demonstrably higher risk of osteoarthritis and a worse course of the disease. The significant influence of nutrition is determined by 2 factors. So the first factor is the relief of the joints. You can reduce your weight by eating a healthy diet, especially a low-calorie diet, of course, and thus reduce the strain on your joints. Patients with osteoarthritis often don't want to hear this, but it's true. The second factor is the anti-inflammatory, and also the somewhat cartilage-strengthening effect of certain foods. Food tip number 1, turmeric. The turmeric plant is a traditional medicinal spice. It has been valued by Chinese and Ayurvedic medicine for its anti-inflammatory effects for over 5,000 years. The active ingredient that the turmeric plant contains is called curcumin. In the meantime, curcumin has also been confirmed in scientific studies for its anti-inflammatory effect. Studies have shown that curcumin really does have an anti-inflammatory and antioxidant effect. That's one good thing. Important at this point, these are studies. At the appropriate dosage, curcumin was shown to be as effective as non-steroidal painkillers, such as ibuprofen or diclofenac. However, since, and here comes the caveat, larger studies with large numbers of cases and many patients are still required, it is currently not recommended to rely exclusively on this yellow spice in the treatment of osteoarthritis. Therefore, it is not an alternative to medication. Anyway, the turmeric plant can significantly improve joint pain, and it can also have a cartilage protecting effect. In order to achieve this, the World Health Organization recommends a daily dose of 3 grams, also for long-term use. Of course, you don't have to eat turmeric straight from the spoon, but you can use it to spice up almost any vegetable, rice, fish, or meat dish. That's my tip. so season with it. You may also have heard of the traditional Ayurvedic healing drink, so-called golden milk, made from plant milk and other spices. It's very trendy nowadays, and indeed it's really good for our joints. If you don't like the taste of turmeric, if you don't like the taste of this spice, then you can simply cover it up with honey or juice, for example. The only important thing is a small dash of oil or other fat, which you should consume with it, as turmeric is hardly soluble in water. You have to know and use this tip, otherwise turmeric is excreted unused. And this is a very typical mistake. Food tip number 2, broccoli. Another vegetable that I really love, broccoli. Broccoli sprouts are highly recommended. The power vegetable contains large quantities of the plant substance sulforaphane. It has been shown in studies to be effective against cancer and cardiovascular diseases as well as osteoarthritis. Once again, the results of the studies must be limited, of course. How much is really relevant for us humans? However, the figures are positive. Broccoli can slow down the progressive degradation of cartilage, and it can also reduce inflammation. The plant substance is best preserved if you only cook the broccoli briefly. You should pay attention to this. There is a huge selection of varied broccoli recipes on the internet, so you can cook a lot of different dishes with it. Broccoli is really good. Broccoli salad, broccoli in pasta, broccoli omelette, make something with sprouts. Sulforaphane is therefore very important, and it can also be sprinkled over almost any dish as a spice. It is not known for certain what amount of broccoli or what amount of broccoli sprouts is effective. Around 100 to 200 grams of broccoli and 1 to 3 teaspoons of broccoli sprouts is probably enough. Food number 3, garlic. I hope you don't think my third tip stinks, because this vegetable is also really good for your joints. So the third food is garlic. We know that garlic is good for our cardiovascular system, but it is also good for our joints and, like broccoli, is said to help with a whole range of conditions, including osteoarthritis. And this is probably due to the high content of sulfur compounds found in this vegetable. The high content of sulfur compounds is likely the reason why garlic is good for osteoarthritis. These sulfur compounds can paralyze enzymes that attack the cartilage. And in this way, they delay the breakdown of the cartilage. So far, however, and this is important to mention here, this assumption has not yet been proven beyond doubt. Therefore, we cannot clearly say that garlic prevents osteoarthritis. That's wrong, and you can't make that statement. But according to current knowledge, around 4 to 5 grams of fresh garlic is probably enough. So it is really easy to incorporate it into your lunch or dinner. And it provides a kind of additional supportive effect on your health and body. However, it is precisely the healthy sulfur compounds, the ones that we want, so to speak, that naturally cause a not entirely insignificant side effect that you know, the strong smell after eating garlic. And this strong smell cannot be completely avoided even with garlic powder, for example, or coated tablets, which you can buy. Once again, and this is important to note here, garlic is an effective addition to osteoarthritis treatment, but is not recommended as the sole therapy. This should not be done and would be wrong. So to say, I take garlic lozenges for my osteoarthritis is not enough. That's why it's not necessary to force yourself to eat garlic, for example, by hook or by crook, if that's not to your taste at all. Nevertheless, here are 2 tips to soften this strong smell a little. The first tip is cutting the garlic instead of squashing it, and adding it at the very end of the meal. This cushions it a little, so to speak. And the second tip is chewing on herbs such as parsley, a piece of lemon, for example, or some cardamom for about 10 minutes after eating to neutralize the smell a little. These are 2 tips on what you can do. Another important note, garlic can, as you should also know, strengthen blood-thinning medication, that is, increase its effect. And it also may cancel out the effect of HIV medication. Therefore, if you want to consume a lot of garlic very often because of your osteoarthritis, be sure to consult your doctor if you are taking such medication. For example, blood-thinning medication. Food number 4, herring. You have probably heard that omega-3 fatty acids are good for osteoarthritis. Omega-3 fatty acids are good overall, and they should be consumed in large quantities. This also has something to do with osteoarthritis. The current research situation strongly suggests it. The fatty acids, these omega-3 fatty acids, are said to have an anti-inflammatory and joint protective effect. And my little insider tip for an effective omega-3 fatty acid supply is herring. Compared to the otherwise often praised salmon, for example, it is usually cheaper and at the same time contains about 7% more healthy fat with a share of 18% than salmon with a share of 11%. I also love matjes, it is really tasty. The best option is to eat the herring as fresh as possible. For example, raw and salted as matjes or as marinated Bismarck herring. Food tip number 5, blueberry. So now something completely different. Last but not least, I have another inflammation killer, blueberries. This also ultimately shows how broad the spectrum really is, so to speak. In other words, your food should be crunchy and colorful. Ultimately, this berry is representative of foods with anti-inflammatory effects. I went into a lot of detail about that. Very important at this point again. It is questionable whether the effects, including those I have mentioned in the video, are really sufficient to have a noticeable effect. In the end, we don't eat anything in the appropriate high quantities or frequency that is often necessary for achieving such effects. And many studies are only laboratory studies, so to speak. But if your diet consists mainly of the good foods that I have just mentioned, and you avoid the bad foods that contain a lot of purine, that is, raw meat, for example, then it is definitely a sensible supplement to medical and physiotherapeutic therapy. Back to blueberries. They are supposed to protect against free radicals and inhibit inflammatory processes. That's what berries do. In fact, research in this area is still in its infancy. However, it is assumed that the blue dye in particular, which is important, the blue dye is responsible for the effect of the blueberry. So, as I said, the study situation is still relatively clear, but this is often the case with topics of nutrition, nutritional medicine, and diseases. For example, in a smaller recent study, reduced inflammation levels in the blood could be detected, and the participants reported less pain and less stiffness. This is not really objective because such studies are often not blinded and so-called placebos are often missing. And this is also typical of these studies relating to blueberries in this case, as well as the many other studies that have been carried out. It is still uncertain how much we need to consume, how much blueberries we should eat to combat inflammation. In the end, we have to do that every day, but we can't eat a kilo of blueberries every day. What problems might then also arise? In the studies, the participants ate between 100 and 400 grams a day. That's quite a lot. However, since you shouldn't rely on blueberries as the sole painkiller substitute in every case anyway, you don't have to be missionary with the amount you consume. That's what I would recommend. Just eat a few. Add them to your diet. If consumed in excess, blueberries have a laxative and blood-thinning effect, and that's why you should not eat more than 100 grams a day. So the most important thing is there is no miracle food. There is no single cure for osteoarthritis. If you hear or read that somewhere, it's wrong. But therefore, combine. Choose good nutrients. Nutrition is an important component, and probably not only because the right foods can have a positive effect, as just described, but especially if nutrition also helps with weight loss. Because as I said at the beginning, osteoarthritis often has something to do with being overweight, with too much strain on the joints due to your own body weight. And this is also the truth. Sometimes you don't even have to weigh too much, but if your joints are unfavorably positioned on top of each other, then every gram is harmful, so to speak, even though you yourself are not overweight. That could be the case. Basic nutritional tips for osteoarthritis. Anyway, if the 5 food tips and recommendations I have just mentioned are perhaps not all to your taste, there's no need to worry. Although these products are strongly recommended due to their particularly high content of anti-inflammatory and cartilage protecting ingredients, you should consume them if you have problems with your joints. However, my 5 tips are also found in many other types of fruits and vegetables, or rather in the nutrients these fruits and vegetables contain. The ingredients are still contained in other vegetables. So you can't go wrong with a diet that is generally rich in vitamins and low in fat. For example, think of a colorful and crunchy salad. The German Nutrition Society recommends following the 5 portions a day rule. This rule means consuming 2 portions of fruit and 3 portions of vegetables a day in order to get plenty of vitamins, minerals, and phytochemicals. In addition, if you eat carbohydrates, you should eat wholemeal products, spelt products, vegetable oils, low-fat dairy products, and fresh sea fish 2 to 3 times a week. On the other hand, avoid fatty meat and sausage products, do not eat white flour products, and keep animal fats as low as possible. Also, you should reduce alcohol and nicotine consumption, because alcohol and nicotine have a pro-inflammatory effect and should therefore be reduced or at best stopped. The positive side effect of such a balanced diet should be your goal. If you have problems with your joints, if you have osteoarthritis, it is often easier for you to reduce your weight if necessary. As already mentioned, this provides additional relief for the joints. Are there any other related foods and tips that you may have learned from your doctor, perhaps from a nutritionist? Write them directly in the comments below the video. Thank you and stay loyal to me.